Wash TV, promoting sustainable development.
Hi lovely viewers, it's a wonderful Wednesday evening and I'm so excited to come your way with the second edition of the Youth Avenue on Wash TV channel. Remember, it's all about you and it's on this show that we sit to address issues that hinders our growth as youth. Tonight, we will continue our discussion on youth, drugs and substance abuse. Before I introduce my guest, I'd like to remind you to please subscribe to our YouTube channel at Wash TV channel, and also follow us on all our social media platforms at Wash TV on Facebook, Instagram, Twitter, and TikTok. This show is also sponsored by the Center for Volunteerism and Social Transformation, CENVAST. For all your individual and corporate volunteer activities, contact CENVAST at www.cenvast.org. And also follow us on our social media platforms at CENVAST. I'd like to introduce my guest now. I'm to have two people, but right now I have one here. The other one will be joining us very soon. And so from the Narcotics Control Commission, we have NCO Godslav van den Bosch. Godslav van den Bosch. Okay, he's the officer in charge of demand reduction. Yes. Godslav, you're welcome.
Thank you.
Okay, so before we get on the topic, our topic for tonight, what can you actually tell us about the Narcotics Control?
Okay, so it's a governmental agency. That's been set up to take care or tackle drug-related issues.
Okay.
And we look at education and prevention. We look at enforcement. We look at precursor control and monitoring. We also look at counseling, referral, and social reintegration. So we have different directories that take care of different aspects of drug use.
Okay.
So basically, yes, it was actually set up somewhere in
91.
Yeah. As part of the conventions, which was to actually help control drug use. Drug use was very prevalent, especially with the cultivation, trafficking. So there was a need to actually enact a law to be able to curtail the problem. In 1991, 2020, 2023.
Okay.
Yeah, we're still here working.
That's good. But you know, people use all manner of drugs and substances. So what are some of these drugs and substances that you've come across, you know, in your commission? I mean, you deal with people like that. So what are some of the drugs that these people have been using or substances?
Okay, so there's a range of drugs we want to talk about, different types of drugs.
Okay.
So I'll narrow to what seems to be legal and what seems to be illegal.
Yes.
The legal ones, though they might be legal, they might be problematic, especially if it's not used the right way. Most of these legal ones, we believe, needs to be prescribed by a doctor.
Yes.
So immediately it's not prescribed, you're actually using it the wrong way, misusing it or abusing it. So we just don't look at the very illegal ones. We actually have taken interest in those ones we believe are causing problems, especially among the youth. One, tramadol, the other things, shisha, tobacco, cigarettes, all of these things quite legal, but they're causing problems among the youth. And we've taken keen interest in some of them by talking about it and actually advising accordingly. But where we actually, our stronghold has to do with those ones that are banned by our law. They are countless. But we can immediately talk about the likes of cocaine, marijuana, heroin, methamphetamine. The list is on and on. So these are the ones we oversee. But we believe that there's also a need. Even alcohol, we try to pay attention to alcohol.
Yes.
Because one way or the other, it's affecting our people physically and all of those things. So yeah, these are some of the drugs we actually take care of.
From what you're saying, it looks like these drugs actually poses some what do you call it? Dangers to the youth when they take it. What are some of these dangers?
Okay, so relatively, it will differ with everybody. But then again, in general terms, if it's not used as it's supposed to be used, you might have issues with your organs.
Okay.
Mainly the brain, your lungs, because these are very vital parts of your body that help with metabolism and the like. So if you have a substance you are abusing, those parts will actually suffer for it. And we have things like you being agitated, the fact that there will be a behavior change, personality change, somebody who's quiet all of a sudden is rowdy and all over the place, and the like. So that the effects run through countless, and it affects everybody differently based on even your age, based on your body mass, based on even the quantity you use at the time. So the effects are varied based on even the quantity you use. I've mentioned that already, right? And then even the drugs, how addictive the drugs are. Some drugs are very addictive, others are quite mild and can be managed one or the other.
Okay. So. But, you know, sometimes you see the youth, we walk there normal and looks like we have no problem. Yeah, sometimes we'll be going through a whole, you know, small bit of stuff. But then what actually leads people to get into so much intake of drugs? What would cause somebody to just go make some concoctions and take?
This conversation, I believe we don't talk about it enough because people are going through a lot. Technically, people are going through a lot, and the least of things, people want to resort to things that will make them feel better. Things that will make them forget the problem. But funny enough, when you take these substances, they don't make you forget the problem. The problem will have a chair. We'll be sitting down and waiting for you after you've used the substances. So one way or the other, yes. I forgot the question.
Okay, so we've just been joined by Mr. Barnabas Mensah, Project Manager for COPS Nation Foundation. Mensah, you're welcome.
Thank you so much. How are you?
Okay, so we're actually continuing our topic, our discussion on the youth, drugs, and then substance abuse. Yes, and God's Love here is actually giving us some insights, and I'm glad you've joined us here.
I'm also glad God's Love is here.
Yeah, he made a huge impact the other time when we had a session.
We go way back. We'll have a proper time to.
Wow. Okay, I'll be ready to listen to all of it. Okay, so to continue, what are some of these preventive measures that we can put in place to prevent our youth from taking so much drugs, alcohols, like all of these things?
To me, right?
Yes. I want Mensah to relax for just a minute. I'll go to him right now.
So some of these things are not cast in stone. Most of the times, it depends on people's way of relating with situations. I can't sit here and prescribe when and how somebody should actually use a drug, but especially when it's banned, fine. When it's banned, again, you can't actually get involved because the laws will actually, well, for lack of a better word, will deal with you. So, look, if you take it and it's affecting you, I would advise that you stop, because some of these things are very introductory. It might seem very mild now, but it will go a long way to actually affect you. You know, we mentioned things about affecting your organs. That's how these cancers and cancers actually start, when you begin to introduce very harsh substances to the body. You understand? So yes, one way or the other, we have to be moderate in some of the things we actually do, especially when it's legal. Seek for, advice from professionals before you actually introduce some of these things.
Mensah, have you come across anybody, any addict? Do you have any person like that, like in your life? Have you met somebody like that? Somebody addicted, battling with drug use?
I think it would be prudent and appropriate that I say hello to the viewers and extend my greetings to them. It's a privilege to be sharing the platform with Mr. Godlove, who happens to be my teacher. He's a great teacher of mine, Yes, I do have persons like that in my circles. I'm pretty sure you are referring to drug addicts, right? Yes, I do have a number of them. And yesterday also I made an example of that man. I was just about saying a gentleman, but I don't think he's a gentleman. That man that I met when I was, ascending that hill over there. So I do see them a lot.
These addicts sometimes want to seek help, but they tend to feel like when they go out there, people will judge them and then all of that. So what way, how do we as people in the community or something open ourselves up to these people that might want to come talk to us in any way? God love.
Yeah, I always talk about not casting a stone, but then again, I think we have to really conscientize ourselves about because there are issues about stigma. Because then nobody plans to be an addict.
Yeah.
People, one way or the other, are introduced to substances. I mean, by very friendly ways. I had a client who had gone through surgery.
Yes.
And I think they had to do with the petity.
Okay.
Was going through severe pain. Later, it looks like the pain was reoccurring. Okay. So because the person was a nurse, he felt this is a painkiller, so I could actually use the substance. So we'll just get it by herself and take it over a period of time. So fast forward, maybe after 2-3 years, now she's able to take 7,000 Ghana cedis to go and buy Petidin because he's getting some level of pleasure again, plus the pain relief supposedly, and it's getting worse by the day. So initially, you could notice that the intention was for good. Yeah. Because the pain was unbearable and she had to actually take some of these things.
Yes.
So sometimes people go through a lot and you want to actually escape using some of these things. So for me, I know it's difficult sometimes seeing them unkept, seeing them wayward. We have to actually lend a helping hand when we can. Not necessarily feed them or anything. Find out how they are doing. Find out where they can actually get help. Yes. There's help practically everywhere. The basic help you can get is possibly going to the hospital. Okay. I'm sure the doctors will refer you to where maybe a specialist can actually take care of you. Maybe the community could try as much as possible to call it TLC, tender love and care. Okay. Show some level of concern. Refer them to friends, family. Because then, if you have to look at what they are doing, I'm sure we'll kill them one day. but we should try as much as possible to show some level of care because they need help. They go to a point where without the drugs, they can't actually function properly. Okay. So we need to be able to refer them to a place where they can actually seek help.
Well, love and care. I think that is the reason why a parent actually wrote to us after our previous episode. Okay. So we're going to use that as a case study. And so let me quickly read a little bit of his story to you, and then we take it from there. And so for identity's sake, we'd like to call this gentleman as Kwamina. So Kwamina is a 22-year-old tertiary student who has been struggling with drug and substance abuse for the past 2 years. He started experimenting with marijuana in his late teens and gradually moved on to harder drugs such as cocaine and can you help me with that word? Methamphetamine. Okay, sure. Despite repeated attempts to quit, he has been unable to break the cycle of addiction. Kwamina's drug use has had a significant impact on his life. He has been arrested several times, can you believe this, for drug-related offenses and has lost many of his close friends due to his drug use. He has also struggled academically as his drug use has interfered with his ability to concentrate and complete assignments. Kwamina's family is extremely concerned about his drug use and has tried to intervene several times. They have taken him to several drug rehabilitation centers, but he has been unable to stay clean for more than 2 months. This is Kwamina. And I want to believe that this gentleman is really suffering, like he's going through a lot.
Yeah.
But God love.
Sure.
Yeah, I tend to always forget your name. Yes. So, God love. What do you think led Kwamina to start experimenting with drugs in the first place? Because if the parents have actually been able to take him to these centers, meaning it's not as if he's so poor and then he was thinking about that. So what really led him? What could be the possible reasons?
Okay. So at this point, I can actually identify something we call addiction. Okay. Yes. And that is the point where he's unable to function. I think I mentioned this earlier. He's unable to function without the substance. Yes. I had, I think, a period of 2 years. Yes. Now, for anybody to experiment, there could be two things involved. The first one has to do with biological influence, and the next one will have to do with environmental influence. So people genetically are prone to some, for lack of a better word, some diseases.
Okay.
So they will carry on the genes from either their father or their mother, and chromosome-wise, they are more vulnerable to use substances. There's actually a chromosome that is responsible for addictive behaviors. So for somebody to start using substances, experimenting in that light, the person could have that problem. Plus the interaction with the environment. The environment, we all know, if you are staying within a place where they sell drugs and use drugs,
yes,
you are more prone to actually use some of the substances over a period of time. So it could be a school, it could be church, it could be whatever. So these interactions, the biological part and the environment, it can actually lead somebody to actually experiment with substances. So having said that, if somebody experiments with drugs, the person might either like it or not like it.
Okay.
So if the person experiences maybe nausea, vomiting, most times that individual will not continue to use the substance because what he's experiencing is not comfortable.
Yes.
It's not pleasant. So most people would end it there.
Okay.
But there are other people who would taste it and might like the feeling and would want to move on.
Who would like to be throwing up all the time?
So maybe the effects might not be throwing up.
Okay.
The effects might be some sense of boldness.
Okay.
You know, our young guys are, okay, I'm going
I want to hear that.
Some guys take drugs just to be emboldened to approach our fellow women because they are either shy.
Oh, I see.
Yeah, so there's this perception that yes, when you take some drugs, it emboldens you to be able to approach women. So for that, if he takes it and he's able to approach a woman, trust me, he will go back
take
to
it again.
that particular approach, and that's how they start using substances.
Okay.
Sure.
Mensah, do you see this in a different angle?
Well, I think it's possible that Kwamena, I'm even wondering why you're calling him Kwamena.
Or are you Kwamena?
Why don't you call him Bob or somebody? Anyway, I'm pretty sure Kwamena perhaps wanted to fit in. He probably has a clique who, a clique that smokes.
Yes.
And just as he was saying, if you're exposed to such a group, the tendency or the probability of you joining such a clique is very high because you need to have people that you can talk to. And if these people, every evening, the only talking point or the only convergent point for their conversation is the we base, you have to find a way of joining them at the we base. So your only option is to join in to smoke. So maybe that is what happened to the woman's child that is resulting in what we are hearing today. So I agree with Mr. Godlove.
But the thing is, me and you were not there.
Ah, yes.
So what actually made him go use substances, you can't really actually tell. But
So if Kwamena is the one who is taking these drugs, how did it then have effect on his family?
Yeah. So it's quite interesting. The more reason why we get worried, because nobody lives in isolation. You live in a society. You live within they say what family is the basic unit of the society. So when you are one way or the other, it would actually affect them one way or the other. Because some of the drugs are that addictive that you need to be able to, they call it, it's an expensive venture, but you need to be able to constantly have the substance on you. And these things are sold.
Yes.
They are very expensive. So the person would now have to either steal if he's not getting the money for it, or actually get involved in some vices. And the discomfort is what will drive them to do the very silly things. We call them the withdrawal syndrome or the physical dependence. When without the substance, he's agitated, he's angry, he doesn't want to talk to anybody. I don't know if you've experienced it before. If you don't get what you pray for, fufu, like this is your favorite, if you don't get fufu, you'll be mad.
Yeah, you keep craving.
Exactly. So if he doesn't get that substance, the next thing for him to agitate and look for a means to actually feel better. The more reason why they might go to family and steal, they might be violent. And one way, all of these things would actually affect the family and the society.
I want to know, you see, if you take a drug once, is it likely, or I mean, is it even going to happen that you feel to go take it again?
That very moment.
Like I just took it once, and then I would feel to go take it again, because I'm saying this when you're answering Kwame's question. I was trying to think that is it possible that maybe it was forced down into his truth, okay, and then maybe after that he was willing to go to continue. That's what I'm asking.
So, you know, I basically spoke about the biological and the environmental interaction. So if the person actually enjoys, there's something called the limbic system. The more reason why when you eat fufu, the next day you want to eat again because you enjoy taking it. You sleep and you sleep well.
I say you like fufu a lot.
That's the most immediate thing, food that comes into mind.
Okay, let's go on.
That's not my favorite anyway. But then again, if it's something you love to do, you want to do it over and over again. There's a part in the brain that is responsible for that, the limbic system. Okay. That is the reward circuit. If you have a certain pleasure, the brain records it and is quick to go back to it because it wants that pleasure. Like I said, somebody might, in experimenting, might take it once and might vomit. He will not go back to it because he didn't actually like, or the brain didn't like the feeling and the reaction. Okay. So he won't go back to it automatically. Unless it is done repeatedly where he gets pleasure, then it would actually, that whole pattern starts again. But when he gets pleasure from it, he wants to actually go back to it. So most of the time, that's how it starts. Okay. And it will mostly start with the very mild ones. We call them the gateway something, the gateway drugs. Because they are legal, and because they are mild in terms of its effects, people jump onto it. Alcohol, cigarettes, the shishas, and the rest. People will jump to it because the effect is not really as compared to the likes of the heroin, which are very addictive. You take it once, and you are actually gone. So I don't know if I tried to answer
you've actually answered it.
Mensah, since parents seem to care so much about people who are battling this, what do you think are some of the ways that they can help these youth who are battling drug use?
Well, I think we have already identified the causes, and he actually mentioned environmental and biological. Yes. Now, with respect to the environmental, I'm pretty sure parents can control what their youths or their children will be exposed to. Okay. I think if your child, for instance, or your teenager uses a mobile device, you probably can activate that parental control so that you guide what he watches and then how frequent he even watches.
That's
that I think
something that most parents would not
don't pay attention to, probably because they don't know. Because they don't know. The other time, I was sharing that example of that weed smoker who I watched that video in the morning at dawn on Facebook. That weed smoker who he was actually justifying why it is important to be smoking weed because he's able to function effectively. He's able to work for longer hours, and then he's even saying that is better than taking alcohol. You get it? And he's raising very salient points that if a kid or a child is exposed to, he's likely to believe that what he's saying is true. So let him go to experiment it. You get it? So if the parents would be so much interested in controlling what their children watch, I think it will go a long way.
Meaning parents need to really take interest in their kids.
They should.
Once they hear this youth, they'll be like, I know my rights. I mean, so because of that, they just...
I don't know if it's the era or the century in which we are.
We're actually very stubborn.
Parenting, I think, will be one of the most difficult to actually do now because the distractions are too much and too many. Compared to then, you didn't have too many TVs, you didn't have too many social media. The parenting was strict.
If a family had one TV, you see one phone, they all gather and be using it. Who is calling? Then Charlie.
But now, we have access to a lot of things.
Yes.
And there are instances where children will portray to be good at home. And when they get home, it's a different ball game altogether. So the parents are thinking they are the best parents in the world. So something happens and they die out, for lack of a better word, they die out of shock. When they get to realize that they are not the children they're actually raising. So for me, I can sympathize with them.
Yeah.
But something needs to be done.
Something needs to be
There
done.
should be a conscious effort to take a look at your children. Check who their friends are. Be nice. Some say you're not supposed to be your friend, a friend to your children. But one way or the other, sometimes it's very important because that's where they can actually open up
to you
as a parent.
Yes.
Because some of them are very secretive. Some children can be very, very secretive.
Yes.
So maybe, in my point of view, I think parents need to be more observant. You have to be firm. The laxity sometimes is too much. You train up the child the way he should go, and he will never depart from it. But if you use that training to the child, somebody else will do it. It could be a friend, it could be a bad friend, it could be somebody else training up that child for you. I know it's difficult, and it's even worse. The economy is even getting bad, and people are looking out for money. People looking out for.
Yes, they get these little monies, and they go get these drugs and all of that.
You're on the go, wake up in the morning because we need to pay school fees. You're on the go, we come back in the evening. So I could understand. But then again, we have to pay attention to how they fend. Your son comes home with an iPhone 14. You can't even afford. How did you get it? Where are you going from 14? So I know they're going to bring 15.
Oh, probably they just keep the 15 go to 16.
So ask questions.
Yes.
But I think it's not even an excuse to say that you are too busy, looking for money. Why did you give birth to the child? Was it just for birthing sake?
The money too is actually important because without it too, the kids will actually also go away.
Oh yes, but just as you're saying, at least dedicate some time for your children. And make sure that the little time that you have for them, it is quality.
Okay.
It is quality. So you can be intentional about what you are going to discuss with them in the 3 minutes, the 5 minutes you would have with them. Than not preparing, you just spend 5 minutes with them and you don't talk about anything. But be intentional about it, and you see that you are spending quality time with them, and then you'll be seeing results.
God love. Since you are from the Narcotics Control Commission, yes, we would like to know some of the resources available for for these abusers. I mean, even let's take Western region, for example. Most people don't know which resources are available to these people, where they can just walk in and go seek help. Can you let us know of a few, if you know of some?
Sometimes it's funny because it looks like the bar stops at the government's part of the organization, but it's quite collaborative. We have to deal with teachers, you have to talk to the community leaders, because then we need to work together to be able to resolve that problem. Now what we can do, or we are doing, is interesting enough. Our laws have changed when it comes to approaching substance use.
Yes.
We used to imprison people for use of 1 rule, 2 rules, and luckily that has been amended in the new law. We have the Act 1019, which I think somewhere in section 47 thereabout. It talks about the fact that when somebody is arrested for use, without prejudice, if it's beyond a certain quantity in the arrest, the judge, it's in the prerogative of the judge to actually refer the person to us for help. And we will liaise with the treatment centers to be able to provide this help for this person.
Okay, so what are some of these centers?
Okay, so
do we have some in do we have some in Western region?
Yes, from our little research, I think there's one.
Okay.
We are here to have an engagement with them. Okay. But it's widespread. It's mostly concentrated in Kumasi and in Accra.
Why? Do we have more of those people there in Kumasi and Accra?
Not necessarily. I'm happy because 10 years ago, you could actually just depend on the psychiatric hospitals.
Okay, and that is a place that no youth would go for.
Because of the stigma that is related to it. Exactly. Yes. And I'm happy to actually count over 14. And these are some of the private
in Ghana.
people in Ghana. Sure. Okay. Private people who have taken it upon themselves to set up some of these centers. And I can't say enough thank you, if I can put it like that. Enough thank you to some of these private people who have actually gathered some interest in the field. They are actually supporting what the government has. So we have a lot of the private people coming up, and we work with them on a daily basis. And lots of them. So what, you will want names?
Yes, if you can help us with the feed.
On top of my head, in Accra we have House of St. Francis, we have Compassion, we have well care. We have Pantine.
Okay, yeah, we know Pantine, yes.
We have a small rehab center in there.
Okay.
That does exclusive addiction related stuff. We have some in Kumasi, we have Brotia, we have a lot.
Okay.
Trust me, we have a lot. But if they need help, they can contact us. We can actually refer them to the most appropriate place. I think there's another one in Kolebu. It's called the Addictive Diseases Unit. They're doing brilliantly well. That's more government. But that's more like an outpatient where you can go and come and seek services.
But in Takrady?
Yeah,
there's one. But we are yet to confirm the name and how they actually operate.
I think we really need to do that. Earlier on Mensah, we mentioned social media being part of contributors to all of these. How can that platform itself, social media, be used to help educate people on these drugs?
Yes, I agree. Social media is a very great platform to propagate the good message, especially from the Narcotics Control Commission. And then I think I should seize the opportunity to appreciate Corp Nation Foundation very well. You know, some of these NGOs and organizations, when you partner with bodies like this commission, I think they can serve you with even the relevant information or the education you can amplify. You get it. Now, on social media, I think that in some of these partnerships with the organizations that have wider wings or tentacles, I'm pretty sure that their social media platforms can be used to, you know, educate the public. They can be using some hashtags frequently, and then in a way or the other, somebody will chance on it, and then it's education to him or her.
Social media. Do you want to say something?
Nothing. I think he said it all.
Okay.
In November, October,
I'm sure.
Amafo Community Program.
November, I'm sure.
Yeah, so we had in collaboration with Corp Nation and other people.
Yeah.
We did a community outreach.
Okay.
And I saw more of it on social media. It wasn't really covered by the traditional media. It was social media that actually took things forward.
Okay.
And people called to ask questions. Where can they seek help? What is happening? How can they be of help? And GNPC Foundation was very supportive on that particular program.
Okay.
I'll use this medium to really thank them for that support. They actually pushed two of our programs, and it was, for lack of a better word, it gave us a good mileage on how to reach other people. People said they hadn't heard of us. I took offense.
Probably you guys are not really that out. So if they say they haven't heard of you, shouldn't be too surprised.
Okay, I'll let it say.
Okay.
But then again, I think we took advantage of that for them to know what is happening in Western region. We did one for Amalfi community. We actually went to the people who are actually struggling. I don't know if you know Main Spain. You don't know Main Spain?
No.
Where we have our people there. So we approached them, we actually had health screening with them, and we took them through some medication, we took them through some slides and all of those things. So that's what we'll be doing going forward. Go to where the affected areas are and engage them. Okay. So, yes.
But I think Narcotics, you should also activate, I don't know, your social media handles, you should activate it.
We have one on Facebook and another one on Twitter. Okay. I don't know if you were, we were live this morning. Okay. We were destroying some of the substances we have seized over the period of time.
Oh, okay.
And it was actually shown live.
I see.
Live, how they were packing all the things, all the doctors.
Because you know very well when people hear about narcotics, they are afraid to approach them. So you constantly reorient us on social media.
Sure. So maybe we'll leave our handle.
Yes.
People can visit that on Facebook.
Exactly.
We are very active on Facebook.
Exactly.
So they can take a look at some of the things we've done.
So social media is not all about entertainment. We can also use that platform to educate ourselves on drugs and substance abuse. I'm still Kukua Sanba, your gorgeous host. And this is the Youth Avenue. I would like to say a very big thank you to the Center for Volunteerism and Social Transformation, CENVAS. And also, I would like to say that for all your voluntary activities, just contact CENVAS at www.cenvas.org. It's on this platform that we sit to discuss issues that hinders our growth as youth. It's all about you, as you know. So today we are still talking about the drugs and substance abuse. We are looking at ways that we can use to prevent all of these drug intake amongst the youth. I don't know who to start with. Mensah, in your opinion, right, what is the most important step that can be taken to prevent the too much intake of drugs amongst the youth?
Okay, all right. I think when drugs or such substances are easy to fetch, too available, and then too cheap, I think that people are more likely to abuse it. So if in any way those things can be made more expensive, I am pretty sure that people would desist from using those substances.
No. God love. Earlier you made mention that you guys were destroying some of the drugs that you got. And how did you come across it?
Okay.
If I may ask.
It's okay.
Yes.
Okay. You can ask that and more. So when we arrest you with the substances in our normal day-to-day, so we have our officers at the airport, some that we will have maybe on our borders. So when we actually confiscate some of these things, it has to go to the law courts. When judgment is passed on it, they now become our possession, if I can put it like that. Then we get a court order to actually destroy them. So it has to go through the process. The more reason why they become accumulated and a lot, because some of the court cases actually drag for a long time. Then it takes some time. So realize that those we are destroying is huge, some in track and all those things. Because without the court passing judgment on it, it's difficult for you to release, because then they are there as evidences to crime committed. So yes, so that's how come we get hold of some of these substances and we destroy them.
So then what advice do you have for the youth out there? Yes. The youth.
A book full. A book full. And it's, maybe you want to, a book full.
Okay.
And I don't know, I'm not in a good place to say that maybe they are doing the wrong thing or I'm doing the right thing, so I'm in the better place to tell them what to do. You know, for me, I always say that a day at a time.
Okay.
We all don't know what we're doing. We learn from our mistakes, then we get better at it. But when you are introducing substances, maybe I'm sure it's in the context of substance use.
Yes.
Be careful what you introduce to your body, because it can go a long way to affect you.
And also, please be quick to add to Kwame's family as well.
Yes. So Kwame's family, they don't really have a problem. You won't have a problem when there's no solution. So they can contact us. We're willing to support them through the journey. It's not easy. It's difficult, because then again, some of these things I mentioned earlier, centers are private and they're expensive.
Okay.
Because then they need to take care of them. They give them food, they give them some actually go through something called occupational therapy. We have to do with taking them through handy works, and that most of the time will cost some money. Okay. So for my advice for the youth is, I understand that pressures. The pressures
countless.
They are getting worse.
The pressure is getting worse.
It's getting worse. So they should try as much as possible to be themselves. They say, and should be a star and pass our star. Okay. We all deal with things differently. They should try and ask those who have gone ahead for solutions. You know, and again, they should be better people, because people have actually walked their path before. So if you are trying to take this path, ask somebody who has walked the path to find out, I'm trying to do this, can I do this, can I do this? I doubt there's something they will do. I doubt they're even listening to me. But the point I'm trying to make is
they will.
They should take it a day at a time.
Take it a day.
When there are problems, it's not the end of the world. Many of us have gotten here because of problems. Being able to surmount that problem. Okay. You understand? I wish I could share some of the problems, but maybe my phone will be trouble. But then again, they should try as much as possible to take it a day at a time, whatever it is. There's nothing too difficult. If there's a problem, dive on, find help, talk to somebody about it, and I'm sure everything will be fine.
Maybe sometimes we feel like the adults wouldn't listen to us. They rather tell us what they think it should be. And you know, sometimes with the youth, we like to be heard. We like that if we're going through something, we tell you, you would try to fit your foot in our shoes and then understand us. But some people wouldn't really do that. And so that's also one of the reasons why. So what would you also say to the older generation.
Okay, good.
Yes.
So they should listen more.
Okay.
Some of these younger folks have issues they would love to discuss with them. Most of them are quick to judge.
Yes.
Say that, why are you going to? Trust me, they would have even got down worse when we were even younger. But then again, they should try and listen to us.
Yeah.
I'm young, you know.
Yeah, you're still a youth.
I'm still a youth, exactly. So they should try and listen to us. They should try and not be quick to judge. There's something called decisional balancing.
Okay.
Look at the good side of it and the bad side of it, and help me make a decision. Don't make a decision for me.
Good.
Try and let me play on the options you're giving me. And when I make the mistake, let me own that mistake. I'll be willing to correct it when I'm trying again. So they shouldn't tell me what to do. They should give me options and let me be responsible for my actions. I don't know if I've said something.
Yes, you've said something. It means I'd like to hear what you would also have for the youth out there.
Yes, but today he's admitting his no pain, so it means he has allowed me some time to say something small. Yeah, I would always advise the youth not to promote or you see. There are times where we see people smoking. The other time I saw a lady smoking, and then it was so viral. And so it sends a signal that if I also want to become popular, I can do something strange.
Sometimes they make it look nice. Like
yes.
You wonder how they do it.
Yes, so even if you are smoking weed in a Mercedes Benz, you are still smoking. You get it. It's not where you are doing it and how you are doing it. So I'm just making a point that we don't need to promote some of these things. If you saw it and you need to condemn it. Then for no reasonable reason, we are just promoting it. Wow. Just recently, I saw a man also who he just passed one funny comment, but he smokes weed, and it's so that WKD something. Look at the story he was trying to put across. And then people are hyping the story, but this is so negative. You get it? So I mean, for whichever reasons that we are going to promote some of these things, we shouldn't do it at all. If you see and then it is not good, condemn it. Condemn it. And then those who also need help, I'm pleading with you to seek help.
Mr. Add your final words.
I think that would be my final.
That would be your final words. Good luck. Anything else to say?
So the Narcotics Control Commission.
Yes.
We need to be popular.
Yes.
Yes. And we've been around for a long time.
1991, you mentioned.
Exactly. So we're working day in, day out. We're constantly in schools. We're constantly in churches on a daily basis. And we are always trying to bring out programs that will speak to the issues. Because I believe that we don't talk about the issues enough. So the reason why I don't take some of these platforms lightly, because you might not know who will be watching and who will be hearing some of these things. So the commission is interested in some of these platforms.
Okay.
So anybody anywhere wants to talk to us about anything, the education and counseling team of Western Region is always available for such conversations, just so that we get the information right. Yes. Sometimes I believe we are misled. We are, you heard there are instances where they say what marijuana helps you become a smart student. Come on. Something that causes hallucinations. You see a cat and you're thinking you're seeing a lion. Yeah, you see when you smoke, you hear babies. How can you
see a cat and you think you're walking on the sea.
Exactly. You understand? So those misconceptions sometimes are worrying.
Yeah.
And people cling onto it and they run with it. And they realize that they begin to have some damning effects, which will live with them for the rest of their lives.
Yes.
So yes, the misconceptions are there. We are willing to always, talk about them and make things right. Marijuana, a big issue. I think we should make time and talk about it and how it is approached elsewhere. What is happening elsewhere might not necessarily translate to what we should do here. We should do what actually best fits our context and our culture. And one last thing I want to add to it is that laws are not made. Laws are not made for just a small set of people. They are made to actually protect the masses. So though you might think marijuana is good in one context, the rest of the public needs to be protected. The more reason why we need to put caution to some of these things that we believe can go a long way to affect our function, especially our brain function.
Thank you so much. Thank you so much. NCO Godlove Vanden Bosch. Did I get your name right?
Perfect.
Okay. And he's the officer in charge of demand reduction, Narcotics Control Commission. And Mensah, thank you. Thank you so much for joining us here today. And Mensah is also the project manager for Cop Nation Foundation.
You're doing a good job. Anyway. I appreciate it.
Thank you.
Okay, so this is the Youth Avenue. We've come to the close of the day, and I would like to say a very big thank you to the Center for Volunteerism and Social Transformation, CENVAST, for all your individual or corporate voluntary activities. Contact CENVAST at www.cenvast.org or all our social media platforms. And also, please subscribe to our YouTube channel at Watch TV channel, yes. And also follow us on all our social media platforms. My name is Kuku Asaniba. This is the Youth Avenue. It's all about you. See you another time.
Watch TV, promoting sustainable development.